All right, welcome to another episode of Medicine Mondays. I am yours truly, Dr. Pierre, your favorite board certified internist, host of Medicine Mondays, as well as the Real Physician Reacts. For my Real Physician React watchers, I definitely want to apologize for last week. Much busier schedule, didn't expect it, so we did not get a chance. I know that's 2 weeks, but we will make that up to you guys, I promise. So this week we are bringing you another one of our COVID updates. As you can see, the title 1 million deaths and counting, just so you can kind of get the mood of what we're going to be talking about today. As you may know, recently we just crossed the 1 million death mark as far as COVID cases here in the United States. Obviously, with a lot more worldwide. So let's kind of give an update on, what COVID is as far as the numbers, as far as the cases. Of course, as far as the vaccinations, we're going to talk a little bit about boosters and more importantly, just kind of give a monologue on what it looks like now, right? As a internist, hospitalist physician, I work in kind of several different levels of the medical field, whether it be in the acute care setting, whether it be in the long-term care setting, and now even the rehabs, right? So I have a good look on what the pulse looks like, especially here in South Florida. And I just want to kind of give, again, my personal thoughts on a person who is not only been on the front lines, but continue to remains on the front lines here during this pandemic, right? So let's first start, I guess, especially for my YouTube watchers. Again, I always encourage you guys to watch Medicine Mondays on YouTube so you can kind of get the visual aspects of what we're talking about. Let's kind of go over some of the numbers here, just so you can kind of get an idea of what we're leading for. So we know right now here in the United States, hope you can look that again. And I love doing this. It's a quick Google search. It makes it so easy for you to kind of know what's going on. Right now, we have about 83.2 million total cases here in the United States, with with a little bit over a million deaths. Right, again, at the time of this recording, and I'm actually recording this on the weekend, which is always difficult because they don't report their weekend numbers, so you tend to see a flush of increased numbers on that Monday and Tuesday type reporting, right? But we already know we're a little bit over a million cases here in the United States. And you can kind of see the states that are leading the charge and that really have been leading this charge this whole pandemic. California, with a total number of cases about 9.45 million, with about 91,000 deaths. Texas comes at number 2 with 6.83 million cases, with about 88,000 deaths, and Florida number 3, of course, my state, with 6.07 million cases total, with about 74,000 deaths, right? And again, just kind of go on back my monologue. I talk about, especially when it comes to the aspect of numbers and the aspect of reporting. The Florida has been notorious a lot of other states right here have been notorious for really underreporting their numbers, not reporting all of their numbers. And, I've kind of discussed this with the advent of the home testing, as far as, test kits that get sent directly to your home. We know that those are just the confirmed cases that we just happen to know of, right? So there's a lot of cases that we don't know whether they've been positive or negative, or whether they're positive and the person just kind of decided to stay home, or they were positive and they say, you know what, I'm not feeling any symptoms, so I'm going to go out and do what I need to do in that regards, right? So again, that's just kind of the U.S. Based cases here. I want to go in, then I do like, I like to do like the worldwide aspect of it, right? Just to kind of give an idea of where we're at worldwide in regards of the COVID cases and COVID numbers, right? So right now we have about 525 million total cases in the world as far as regards to COVID, with 6.28 million deaths, right? And again, who is leading the charge? Of course, the United States. With about, again, we kind of mentioned 83.2 million total cases, 1 million deaths. Number 2 is India with about 43.1 million cases, right? Again, a little bit under half of cases, a little bit over half of cases of United States, with about 524,000 deaths. And Brazil comes in at number 3 with about 30.8 million cases, with about 666,000 deaths, since the start of this pandemic. And I think it's important, especially when we think about, the end of the pandemic, right? Because that is probably one of the most well searched and more common questions that I get all the time. Like, hey, are we out of this pandemic? Is this pandemic over? right? That's just, I get that. When is this pandemic over? Because for a lot of people, that is a mental block that they need to kind of get over, right? They want to be able to say, like, yes, I've made it through the pandemic and I have, quote unquote, nothing to worry about, right? So let's just look at, and let's go back on our screen here just so we can kind of look at the graph, right? Just so you can see, just so you guys can get a nice little idea. Again, let me break it down. United States again. United States here, so we can kind of see what the graphs are as far as kind of new cases are concerned. Especially if you're watching this on Medicine Mondays, you see that we have a few humps here, right? This was our initial hump when the cases first started going crazy. This around again that July. This is around the Delta time frame. We see this kind of outlier of an abnormal hump. That is what Omicron has done. And you can kind of see here us kind of tailing off. But again, your eyes do not deceive you. You can kind of see that, over the past month or so, cases have begun to rise. And we kind of mentioned this when we talked about the subvariant of the Omicron, essentially, causing an increased number of cases. So now let's look at deaths during the same time frame. Again, I like showing people this graph, right? When they ask me about, like, how are we doing? How, like, are we out of this pandemic? I always kind of show them this graph because I want them to kind of visually see it, right? Because it's one thing for me to get on here and, talk about the numbers, right? It's another thing for you kind of visually see, kind of this kind of roller coaster ride in regards to just average number of deaths in the 7-day period and whatnot, right? And like I said, I fully expect on Monday and Tuesday for us to see a kind of a bump and rise in cases that don't typically get reported over the weekend, right? And again, I do harp that the light is a little brighter than what it has been. And by saying that, are we in the clear? No, right? And we're not in the clear is because we know that there are pockets of cases and pockets of states and pockets of areas just in this country where things are starting to rise, right? We've already talked about how there's already, again, and I like to think about when we talk about COVID, the reason why I like to separate the United States and what the worldwide web is doing, right? Worldwide countries are doing, right, is because they operate with much more sense of urgency, and they are not, quick to get back to quote unquote normal because they understand how detrimental and how deadly disease was to their country, right? So they're not quick to rush back. Unlike the United States, who is like, let's go, every man and woman for themselves. Let's keep it moving. So when we talk about just kind of the number of cases, and we're seeing these rising cases now, as you can see, obviously, depending on who you follow on social media or who do you follow or what news channels you may watch, right? Like COVID isn't, a hot topic anymore, right? It is not something that gets talked about, at the fervor that it used to be talked about. And what typically happens, unfortunately, and this is kind of the reason why, especially in medicine, we have our months where we celebrate Breast Cancer Awareness Month, Heart Association Month, right? The reason why we celebrate it is because we know for a lot of people, it is out of sight, out of mind. So for a lot of people who, when they're turning on that news and they're not seeing that ticker anymore of COVID cases and COVID deaths, and when they're not seeing, being bombarded with COVID, when that's not happening, they think everything is all good. Fortunately, you follow me, you watch me, you listen to me, and you listen to people like me. So you understand that we have still been talking about COVID. Haven't changed any one bit whatsoever. So again, for me, you're always going to get these kind of COVID updates on at least a monthly basis, just so you guys are aware, especially in the lunch learn community. Hey, like, yes, this is something we still need to worry about. So I want to talk about and kind of transition over to kind of the vaccines, right? Because it's one thing to kind of talk about what COVID has done as far as deaths is concerned, right? But the vaccines are even more important, right? Because it is playing a significant factor and, why we're ready to move on or why we can move on. Like, as you can see, you're not hearing me say like, no, I want everyone to stay inside, and because I already know that especially here in the United States, that's not feasible, especially because people mentally are not going to go back to that again. We know that from a business perspective, that is not going to happen again, right? Where people are like ready to like move forward, right? we already know that. So let's talk about kind of the vaccines, right? Let me kind of share my screen here. All right, perfect. And like I said, Google is our friend. I love Google. Let's just talk about our vaccines, right? Just so we can get kind of the, here in the, let me break down, show it all, just so we can get a United States version, right? Just so you can kind of see the numbers. As of May 19th, at least 258 million people have received at least one dose of the COVID vaccine, depending on which one they got here in the United States. 67% or 220 million are fully vaccinated. 67%. Again, remember that number, because remember, we used to, in the beginning, we were all talking about the 70%. Hey, if we can get to 70%, if we just get to that number quickly, like, we can get over it quickly. Of course, people scoffed at us. They didn't pay us any mind. And then about 102 million people, or roughly 31% of the population, have gotten at least one booster. Now let's break it down again worldwide, just so again we can see what the worldwide numbers are. And I like talking about this, right? Let me show myself real quick. I like showing just how many cases, especially here in the United States, and how many doses have been given out worldwide, right? Because you still have a contingent or horde of people who are like, nah, like I'm letting the guinea pigs go by, and then I'll see what it looks like. Just trying to make an excuse why they're not going to get vaccinated. Again, you're grown, you're not getting vaccinated. Just say you're not getting vaccinated. So I like showing these numbers, right? Because it really is eye-opening, just so you can see, just again, here in the United States and just worldwide, how many people actually receive this dose, right? And the reason why, I remember I was on one of my YouTube videos where people said that, like, this first batch of COVID vaccines, everyone who got this is gonna die, right? Like, and I try to rationalize. I said, all right, let's think about this, right? Do you think that millions of people, like dignitaries, worldwide leaders, are all going to take this vaccine if they thought they were going to die? Do you actually think that that's a possibility? But that's when I realized those who are against the vaccine will make up any blatant lie they can to try to justify not getting the vaccine, right? Like, they just make up this is a whole bunch of lies. Oh, I'm just waiting to see more people get it, right? Just even those who've been affected, right? Those who've been, again, just a quick little segue. Those who got COVID and didn't get the vaccine, those are the funniest people, right? Because the excuses they make, even though, and I'm not talking about got COVID and been asymptomatic. I know plenty of people who have gotten COVID, have been symptomatic after getting COVID, non-vaccinated, right? And still make up like these BS reasons of why they can't get vaccinated or why getting vaccinated wasn't important, right? When I tell you, talk about a luxury that you were just fortunate enough to not die from getting COVID because you were not vaccinated. And then to try to make light of, like, oh, you see, I told you didn't need to get vaccinated. I just had a little cold that, that took me out for like 2 weeks and I couldn't exercise. And that's all it was. Nothing biggie, right? It's, again, just pure comedy from those folks, right? Let's kind of look at these worldwide numbers real quick. Worldwide, like just so you can kind of see, 11.8 billion doses have been given out worldwide. 11.8 billion with a B, y'all. 4.71 billion people are fully vaccinated, which makes up about 60% of the worldwide population has been vaccinated due from COVID, right? And those numbers, just again, they're astonishing, but they're just amazing to see, after 2.5 years, right? Because again, we're not even year 3 yet, right? After 2.5 years, kind of where we've gotten to versus where we started. Now, of course, unfortunately, to get to this point here, 2.5 years later, we have 1 million people who did not make it and counting, right? Because it's still happening. We have 1 million families and more, right, who will forever be affected by this virus. And for those who don't think the million is like a big number, right? Remember, in the 2.5 year span, the flu that we all know, that we all love, the flu has killed in the past decade, from the year 2010 to 2020. In the past decade, the flu has resulted here in the United States 335,000 deaths. 335 in a 10-year span. So think about that. In this 2.5-year span, COVID was able to take out over 1 million people. 2.5 years. But in 10 years, the flu was only able to take out 335. And then depending on where, it could be closer to 359, right? But clearly nowhere near the million, right? Just to give you an idea, how many more decades would have to occur for the flu to catch up to that 1 million case, right? Is so when you hear people scoff at the severity of COVID-19 and say like, oh, it only kills 1%, 2% people, right? Like when you hear people try to make that argument, you just hit them with the numbers like, hey, but if 100 million people end up getting COVID, 1%, 2% is a lot of people. And I always ask, like, if you're okay, right, with 1 or 2% of people dying, like if you're like, hey, you know what, people are gonna die, I'm okay with that, then tell me which one of your family members you're okay with dying. Just list them out, write them out. Like if that's you're okay with, right? And that's when you have to kind of snap people back into reality and what we're dealing with when we talk about COVID, when we talk about, the severity of COVID, right? Because again, we talk about the million people that died, and we talk about 83 million people got COVID. That doesn't mean 83 the people who did not die are walking around running marathons. Like I'm taking care of patients who have been out of the hospital less than, let me see, in the past 6 months, less than 2 weeks, right? They've been in hospital to long-term care facility to extensive rehab, right, for the past 6 months, right? I'm talking to people who will be forever debilitated from contracting COVID 5 months ago, 6 months ago, 1 year ago, still debilitated till this day. I had an unfortunate patient I was taking care of who, now this wasn't even a direct effect from COVID, but it might as well been. Because of COVID, she lost contact with her physician. And because she lost contact with her physician, we kind of talked about this before, because she lost contact with her physician, she didn't get her regular routine screening. 2 years later, she realizes like, hey, I haven't gotten a mammogram, during this time. And in 2 years, she's developed, significant late stage breast cancer. Now, again, that number is not going to be tallied to COVID, but it might as well been. The amount of people who we're going to have, and I've talked about this before, we're going to have an increased number of deaths from people who just could not get in to see their doctor. We're going to have increased number of deaths from people who, let's say, they were working and then they couldn't work anymore, so they lost their jobs, right, because of COVID and the effects of COVID, right? You're seeing layoffs happen everywhere, like Facebook laying off people, Twitter laying off people, Netflix, like you're seeing layoffs happening at all different fashions because of the effects of this pandemic. So when we talk about that 1 million deaths and counting, it's like there's like a parenthesis of people who are forever going to be not necessarily counted within that 1 million deaths, but might as well be. And as a physician, especially over this past 3 to 6 months, and I'll just shorten it, right? Past 3 months, right? The past 3 months where you continue to have more and more of a push for, us to kind of get over it, right? And that's essentially what they're telling people, like, let's just get over it. Let's just get over it. Let's get back to new. You're seeing mask mandates, being taken away. You're seeing people just act like everything is normal, right? Like that's what's kind of happening. And even though, unfortunately, now because it's not getting the fanfare that it used to get, right? These numbers are rising. The cases are rising. And unfortunately, the way the CDC kind of changed their guidelines to try to say like, no, we're going to count hospitalizations, which is dirty and sneaky because, and fortunately, at this time, 2.5 years later, we got a good amount of our population vaccinated. And we know that being vaccinated helps decrease your hospitalizations. So because we have more and more people who are getting ill from COVID, but not necessarily being hospitalized, it's being recognized as not a hot place, right? Not a significant concern. But we know the numbers are rising, right? Again, I'm recording this, right? It's going to come out, what is this, like this third week of May, right? Coming third week of May when this drops. And we know that even if you don't see significant numbers of cases rise, right, we know there's still going to be significant people who get affected, significant people where they miss work, right? They can't go to work, they get sick, they're out for a period of time, their family gets out for a period of time, right? We know that that's going to continue to rise, and it's really going to be up to physicians like myself and healthcare workers like myself and educators like myself to kind of continue to sound the horn and say like, hey guys, like, yes, I know you guys want, right, to get, I know you want to get over it, right? But like, if you're going to get over it, it's gonna take a group effort, right? We all know how group projects work. It's going to take a group effort if we want to get to that point when I could say like, all right, yeah, you guys shouldn't have anything to worry about. Like, again, I've told you I am vaccinated, I'm boosted, right? Like I can't get the second booster, right? I'm not eligible for it, but the second I'm eligible for it, I'm going to get boosted as well. The whole family is vaccinated, right? Because it just because I want to make sure that if something were to happen due to COVID, that I have done everything I can to try to prevent that, right? Like, and that's really the case in counting, right? When we talk about these million cases, right? Like, these are a million people, these are a million plus families, right? Friends, like, who are going to forever be affected by this in the grand scheme of things. From a timing standpoint, 2 years, right? Oh, not even 3 years yet, not even 3 years. And families worldwide, but especially here in this country, are forever affected, and they're never going to get back, right? That's like that norm that people are looking for, like, that's not going to happen, right? Like, it just is what it is. It's just not going to happen, like, at least this year, right? At least in the year 2022. I don't think so. Maybe in 2023 we're singing a different tune, right? Maybe when we get up to 75% and 80% vaccinated, and I think, again, right, I think the numbers were like 30% boosted, right? Maybe when those numbers get higher and we're not having to worry about more variants that are deadlier, because again, variants are coming, right? They're going to continue to come because that's how these viruses work, right? These viruses want to continue living, right? So they're going to keep making variants. So we in the healthcare field, the public health field, like, have to continue to prepare our population right here, especially lunch and learn community and others, right? We have to continue to prepare you guys, for those variants, right? Like, I'm not even going to talk about monkeypox right now, right? That's a whole nother discussion, right? I'll probably have one of my infectious disease friends kind of come on here to talk about that, right? But that again, right, it just is what it is, right? Like, it again, that's, I'm watching it, right? Again, it is something I'm watching. I get right now, my eye is still on COVID, and as well as the flu and everything else that it needs to be on. But when you hear these kind of rumblings of these new viruses and these new bacteria and everything else that keep popping up, right? You can only watch with caution, right? You can only watch with caution, and then again, just educate whoever needs to be educated, man. So again, I am yours truly, guys, Dr. Barry. Again, thank you for joining another episode of Medicine Mondays. And if you listen to this on a podcast, shout out to the Lunch and Learn podcast listeners, man. Appreciate all you guys and all you guys do for me. And I'm gonna see you guys next week.